Hey everyone, Dr. Daryn from Next Physio. I have our special guest today, world-renowned Raleigh local favorites, Darren from
Move Fitness for her.
Thank you. The owner and founder right here. Today we want to go over a couple of things as far as exercise interventions that are very basic to getting the kind of fitness that you want to get to, but also making sure that you're not compromising your form in doing so. And so Darren and I are going to talk about different cues that we like to use in our populations. And then we're going to see how we can apply those to different populations that we work with, special populations, including Darren, which I know you can't tell, but she had a freaking hip replacement and she's still crushing life and recently played tennis yesterday.
Yep, 6 months ago.
Amazing. For those out there who've had a replacement of the hip, I want you to know that you can get back into shape. First of all, don't let that be your crutch for why you can't get back into shape. But instead, if you have people like Darren who's been through it, and if you happen to be in the local Raleigh area, she is the person that we refer to. So if you need to get into shape after any kind of replacement or really any kind of condition related to both menopause and postpartum issues, she is one of our go-to trainers in the area. Having said that, let's go into the 5 foundational movements that humans should be able to do at any given age, whether you're 20, 10, or 60 or 70. These are things that you should be working on a day-to-day basis, especially if you're going towards the older ages, like myself. Being 50, these are things I do on a regular basis because I don't want to lose the mobility and I don't want to lose movement options. And a lot of people start suffering later in life because they lose those options on how to move appropriately. But I can guarantee you that if you stick with these 5 different movements on a regular basis, you will be better than most humans at your age, I promise. That being said,
Jerry and I are also going to show you how to progress and regress exercises because life is not perfect. You might get an injury that you're recovering from. And so it's okay to take your fitness level down for a while you are healing.
And Darren, I'm glad you mentioned that because one thing we talked about is how if you do take a lot of group classes, I am part of different groups for fitness, it's really easy to get stuck in your ego and do things that you probably know at that moment before you're about to do it, that you shouldn't be doing that movement or you're feeling a little off that day. I have gotten myself in a lot of trouble just by listening to the ego. And so I can tell you recently, I actually recently pulled my hamstring, not listening to myself, not taking my own advice. It happens to the best of us. And when I didn't listen to that voice, I got hurt. And so one of the things we want to try to harp on is that, listen, if you have to regress, like Darren said, it's totally okay. One day out of the next 20 years to do a regression is not going to hurt anybody, especially you. So
we do it all the time.
Yeah, look, we're preaching to the choir here, honestly. And it's definitely hard to beat that part, especially if you've been active your whole life and you're approaching your 40s or 50s, and myself included, and Darren as well. But you're only 29, sorry. Yeah, sorry. It's hard to put or dismiss that voice. But I can promise you that if you continue on this path towards the best version of yourself, you will have up days and down days like Darren had mentioned. And it's about learning to work with that and realizing that you can't lift like you did in your 20s without different kinds of things. Like I have to do a full warm-up before I go into a high intensity workout. Yeah. So I have to carve out an extra 15 minutes for myself because I know what trouble areas I have. But whenever I do that, I don't get into trouble. The days I kind of rush in and say, I got this, that's when I get into trouble. How about you, Darren?
Exactly. I decided to hit some tennis balls yesterday without a warm-up. So hence why I'm seeing Dr. Jerry today. He's helping me with my shoulder because I did not do my shoulder warm-ups prior.
Yes. I know. So listen, it happens to the best of us again, but let's go through these movements in general, things that you probably already know. And I can tell you from the experience that both Darren and I have had, that even with these basic movements, when you think you're doing them right, there's some tweaks you can make to make your form look better, and that so the exercise will actually work better for you, especially if you have different conditions and limitations going on. Shall we?
Yep.
Okay, so Darren, tell me about your favorite cues and how you walk someone through a squat. I'll be your demo.
When I'm working with a first-time client, if I want them to do a squat, I usually have them start in a seated position first. So please go ahead, take a seat on a bench or a sturdy chair. You're going to have your feet hip width apart. Make sure that your knees and toes are facing forward. And sometimes I always look, people think they have their feet straight, but sometimes what they feel and what is actually there is not true. So can you leave your toes where they are and just open up your heels a teeny tiny bit like that one? No, and outside. Good. Okay. And then now from this position, why don't you go ahead? I'd like to actually, I have children, so we have tons of Legos at my house. So I usually say, think of a Lego person that you can only fold one way. So at your waist, imagine we're cutting you across. I want you just to have a slight forward lean from the waist up and put pressure in your feet as if you're trying to hold the ground down. And rather than looking directly down, you will look forward. Okay, and if you like, you can reach your arms out. Nice strong arms. I shouldn't be able to press them down. Good job, Jerry. All right, and then, so we're pressing the floor. We already have this forward lean, and our gaze is forward. Now from here, we want to stand up, and you're going to come to a full standing. Squeeze the glutes, but not too much to where you push your hips forward. Yeah, not like that. All right, now, same thing. Now we're gonna lead with our hips as we sit back down, so our butt is gonna be searching for that chair. Keep those arms forward, gaze forward, and go ahead. Start to lead with your hips first. Your knees will follow until your hips find the bench.
That's awesome. One of the things that is a myth, by the way, and it still gets perpetuated even now, which is sad, is that you'll often hear people still talk about, oh, you got to keep your knees behind your feet. That is not real life. And so if you've been told that, I want you to put that out of your mind for a second, unless you've got some like patellar tendinopathy, in which case I might agree with that. But really, you're not going to be looking at your knees coming before your feet, and any kind of athletic endeavor, that's just not how things work. So don't be afraid to do that. In fact, making sure that you can do that kind of motion is going to be really critical for everyday things like picking something from the ground, like going to the toilet, like going upstairs. You're not going to be focusing on keeping your knees behind your feet because that's not everyday life. So just a sidebar there.
No, that's great. Thank
Great.
you for saying that.
My pleasure. Now, for me, if I find somebody and typically with a beginner, I always like to start in a seated position because sitting down, standing up is something that we do every day. And so it becomes very easy for them to integrate that activity into what they are going to do for the exercise. That being said, there are a lot of guys and gals out there who don't have a lot of great mobility in the hips. And in another video, we'll talk about how we assess that so you can get a better idea of what things you can do to improve your hip mobility, whether it's limited into what's called external rotation or internal rotation. What I want to talk about today is if we have some guys who come up and they start doing this thing with their knees, they're probably likely having an issue and limitation in hip external rotation. And what we want to do there is work on things to open up the hip a little bit. Now, one of the easiest things you can do right off the bat is just put your feet out a little bit. And that's going to cause a lot more room in the hip space so that you can move up and down in the squat position. The other quick remedy that you can do is get your heels elevated. So what that looks like is, I happen to have a small barbell plate here. I'll put that on the ground there, and you can use anything at home. I've had patients use books. I've had them use little like 2x4s, anything to get their heel elevated, because that will actually allow for the hip to open up a little bit better, biasing towards hip external rotation. So in this case, what I'll do, using Darren's cues, is I will keep my feet aligned, but I'll turn my toes out a little bit. In this position, I can use my hands to counterbalance, especially if I don't have great ankle mobility. And here what I'll do is go into the same position that Darren mentioned, make sure I have a little bit of a squeeze in my butt, but more importantly, I have a proud chest, and I'm trying to push the world away as I stand up in that position. So once again, see the position, and here. And another reason, and Darren, I'm really glad you picked this box, because what people don't know is your hip goes through 3 different phases as far as rotation goes in the hip. And if you are somebody who has a hard time holding a wide stance or you can't keep your feet together, if you work in this position where your hip's around 0 to say 60 degrees or so, you're going to be working on external rotation of the hip. And so here, if you're on a box that's a little bit higher than your hips and you stand up, you're actually working and grooving that bone inside of this socket into a position that's going to open up the hip better so you can have more relief. From there, you can start loading it. You can also start now working into deeper ranges, but mastering this range in itself can be exercise as well. And you can go heavy on this too if you have problems with that. Maybe you have had surgery there, you haven't been able to move and you're very stiff. This is one way that you can actually do that from a very safe position, but also work on the fitness goals that you still have. And so look, when you have a trainer like Darren, working on these kinds of positions with the right load and right progression will still get you to the fitness goals that you want to get to. So
I started at a higher level after my surgery and worked down.
Yes. And Darren, obviously you've had some great physical therapy. But really, the cool thing is that you have not stopped moving. And I want you to share that with the audience because There are a lot of people who think that, oh, if I have this surgery, I'm doomed. And that has not been you.
No, and it also wasn't the doctor's recommendation. So I probably gave myself one day after surgery of no, scratch that. I moved right after surgery. They wanted you to walk. But even when I was laying in bed recovering, I always did some heel slides or just even ankle rotations. Like I had to keep moving, not just mentally, but physically. I needed to start just strengthening my hip or just supine, straight leg glute squeeze, where you just lay in bed and just contract your glutes and release. And then from there, after I got the clearance from my doctor, then I was able to do just some very high, minor, little squats.
That's great.
So.
And what are the restrictions for hip replacements that you were told, Darren, if any?
In the beginning, you do not want your hip to go in extension. So all my movements had to stay in front. I could do little side taps, but not back until you get doctor approval, which is about 3 weeks.
That's great.
But depending on where, if you get an anterior hip replacement or a posterior. I had anterior, so I'm not 100% sure of posterior.
Yeah.
But Dr. Jerry, you could fill me in on that.
Exactly, yeah.
Is it the
well,
same?
Yeah, it's a little different. But the other thing that I want to mention is that did they talk to you about not being able to bring your leg over this way?
Oh, correct.
Yeah,
yes,
crossing,
yes. Yeah. No crossing over,
Yeah.
absolutely.
But the reason I want to bring that up is because one of the things that you don't want to do if you've had a hip replacement is, you probably know this if you had one, is you don't want to go into this movement. So hip adduction, we call it. So bringing the hip over to the side, crossing the middle of your body, and turning the hip this way or foot this way will cause an irritation in that area and could actually do some damage there. But that's another reason why doing an elevated squat is more preferred, because you're going to keep the hips in an open position, which will allow you, again, to work in the muscles, especially if you want to get bench fitness goals and you want to get stronger faster. One of the things you can do is get into this position with the hip, with the heels elevated, feet apart, toes out a little bit, so you can create a little more space in that hip and not be irritated when you're doing that. Cool. Let's move on to, let's talk about, with the squats.
What about if you're beyond seated chair squat?
Yes, let's do that. Yeah, for people who aren't starting out, progressing this, how would you progress someone from the box?
Okay, stand up,
Yes.
please. And I would say, let's move this. Let's stick with the heel elevated. I think it helps the majority of us. Actually, let's move that back further. So do you want to stand in front?
Sure.
So just your heels are going to be on a plate or on a book. And Jerry likes his toes turned out. I think most of us do. We do a lot of sitting these days, so that will help open up your hips. Okay, so we've gone over seated. Now, before I do any exercise, I always try to talk to my clients to run through a checklist to make sure they're set up properly. And I compare that to if you get in the car and you're driving. You check your mirrors, you put your seatbelt on, make sure your seat's in place. So let's do that before we even do any sort of exercise. So I usually start from the head, work my way down. So just to make sure, is head in line with your shoulders? Are your shoulders stacked over rib cage, hips? And just go down the line of the kinetic chain. Because we don't want to start in a squat, either rounded shoulders like that or opposite in an anterior pelvic tilt. So nice. And I always like to take a little inhale through the nose, exhale through the mouth. And as you're exhaling, think about bracing your core. So if I was just going to go and punch, he would be able to take it. I don't know, maybe not my punch.
Oh, yeah, very powerful, very
Yes.
powerful here.
Okay. And then you can have your hands wherever you are comfortable with, if you want them forward or at your sides. So same thing, lead with the hips, keep this kinetic chain in line, but now what we're gonna release from the kinetic chain is our hips starting to shift back. Our knees will follow. And just go to your lowest point. Wow, it's a nice deep squat. And I like to hold it for a second. Where do you feel this? Can you sit back in your glutes a little bit more? Is your core still engaged? Are you pressing your feet into the floor? This is also a strong position. If you have a tight pelvic floor, this is where I would like you to give another exhale. Let's release that pelvic floor, whether you're a man or a female. All right, and now as you stand back up, you're holding that ground, pushing the ground down, coming up nice and strong.
Excellent. And this is a great position too when we talked about lifting the heels. If you struggle with squats in general, and this is for people out there who have been doing squats for a while, if your squat, and I say this because there are a lot of people that I meet in different classes and whatnot who still struggle with the squat. And if your squat looks something like this, where you're hunched over with the weight, there's a lot of, you might have a limitation of the hip, you might have a limitation of the ankles. We have to check for both. So if you don't look like you're upright and your chest is proud in that position over here, and you can't break 90 degrees at the knees without having to do something like this, that's something I would take a look at. I will actually probably have you shorten your range a little bit so that you can get the right mobility first before you go into those deeper ranges, because you're just going to cause more compression through areas that you don't want to. So that being said, an easy fix for most people out there is going to be elevating your feet, or your heels rather, and getting in that position where you can keep that proud chest, eyes are forward like Darren had said, going through that checklist. As I come down, I can still maintain upright position. I'm going to try to push the world away as I come back up into standing position.
Now, question, or what is your opinion on depth of squats? Is it parallel or?
That's a good question. For everyday fitness and even for if you're doing any kind of heavy lifting, if you can get to 90 or break 90, that's a great spot. I don't think you have to go full ATG, otherwise known as ass to grass. So I don't think you have to go all the way down where you're all the way down over here. You can if you like, that's something you want to do, but you're not more
I can
functional.
Do that now with my new hip.
Yes,
or
very
almost.
good. Brand new hip. But these are things that, is there a cost benefit to going that deep? I don't really think there's a much more benefit by going that deep into your squat, unless you didn't do that for your sport or activities, for your work, whatever, that's a different story. But for fitness related purposes, at least 90 degrees would be a great spot, if not a little bit lower than that, and that's probably about it. How about you?
I agree.
Yeah.
I usually keep my clients at 90.
And if you're doing this right, you'll probably feel quite a bit in your quads, a little bit in your hamstrings, and some in your glutes, especially as you get heavier in your weights. And then, of course, we didn't talk about barbell yet, but just going into the basic form of the squat, it's just looks something like what we just described, where you're still having a proud chest, you're able to get to the ground in a comfortable position without having to compensate movements and look hunched over. Otherwise, you can run into problems later on as you increase the load. Shall we move on to lunges?
Yes.
Great. So why don't you, with many different kind of lunges, right? You've got forward lunge, we got the reverse lunge, we got curtsy lunges. Do you have a particular favorite that you like to go over?
I think I always start with the reverse lunge. They tend to be the easiest.
I think so too.
One thing though, I like to begin with the client in the kneeling position and make sure that your front knee is 90 degrees and that your back knee is underneath your hip. Tuck and squeeze that back glute, and you're on the ball of your foot. And then back to that Lego person, breaking in half. I'm gonna lean slightly forward so that the majority, I'm really pressing in about 80% into my front foot. And I always put them next to a box or something that they can hold on to in the beginning. And from here to see if they can stand up. Sometimes this is not ideal and I have to regress. I just want them to get the idea of what this feels like, so that when we do start in a standing position, when they step back with their foot, I want them to try to keep that knee underneath their hip. Now, I don't know, you might have a different way, but there are so many ways to do lunges. You could have this leg further back, but really we want to get the glutes and hips firing, so that's why I like to keep the knee under the hip.
Definitely. I would say that depending on the person, what their mobility is like from our first assessment, what their fitness level is like, and what they're looking to do. One of the things that I think Darren's going to mention later too was the position of your torso is going to dictate what we're going to bias more. If I hinge at the waist over here, I'm going to bias more movement and more output from the glutes over here and the hamstrings in this position. If I go down over here and keep that position, pushing through the ground and being especially heavy on that heel, really important, I'm going to get more back over here. If I stay upright a little bit and go upright, proud chest like we did with the squat, I will probably feel it more in the quad, which I do right now. So depending on what your goal is for that day, for the activity, that can easily shift the emphasis towards one part of the body versus the other. The other thing that we want to look at is looking at the lunge, making sure that, or actually deciding depending on what that person's goal is or the goal of the therapist. If somebody has a restriction in external rotation, I might actually have the weight, or if they have balance issues, I may actually have the weight more on the outside of the leg over here. And that'll actually shift a little bit more, we'll just say for simple terms, stuff going on in the pelvis and the hip will actually allow for more space in the hip to occur if that's where your limitation is, by using a weight on the outside of the leg in this position. If I want to challenge myself and really get some more core involvement, we'll just say, holding the opposite hand in same position over here, that's going to get a little bit more output from the muscles to help stabilize the spine, but also from the hip as far as internal rotation goes. So you get a little more bias in that position by going into having the weight on the other side. So again, depending on your goals, depending on your level, we might have you hold the weight in one hand versus the other. And if you want to bias one set of muscles versus the other, I might either hinge or I might either stay upright in order to execute that movement. Sound good?
Sounds good,
Yeah.
yes. I'm a proponent of the hinge. You can't work the backside too much.
I'm not going to disagree with that, actually. Yeah, I think a lot of people can get more benefit out of the hinge approach to lunge versus the upright approach, because you get it from squats. A lot of us are probably more developed in the front anyway. We lack a lot of stuff in the back, and that's one of the easiest ways to achieve that. The other reason why I love the lunge too is you get to work each leg separately. And we have a lot of runners, 40 to 60 as an example, where they are maybe stronger or imbalanced on one side. And running is a single leg sport. So
Walking is a single leg sport.
Walking is double support, but with running in particular, what's going to happen is as you are running, you want to make sure that you can cover as many imbalances as possible through your strength program, which is why, yes, we will start off with double leg support with squats and with deadlifts and stuff like that, but we quickly try to move into doing things that will challenge each side separately so that each side can work on getting strength gains as well. And why do you want to strength train as a runner or as somebody who is active over 40 or 50? You want to make sure that you can cover as much, or again, like I said before, having as many movement options as available. Correcting for any imbalances and whatnot will help you to be able to have the options that you want to have later on in life as well. Cool? Cool. Any other lunges that you like to do?
Reverse. I love a lateral lunge.
Oh, yes. I'm so glad you mentioned that. And that actually didn't make our list here. But why do you like the lateral lunge?
It just gets us moving in a different direction that we don't move in every day. And it also trains the brain too, because in a lateral lunge, you'll step out and you'll just shift into one side. And it also helps the brain just work one side at a time as well.
I would say, yeah, definitely. And with the lateral lunge as well, and I think you nailed it there, where we don't do things enough on a day-to-day basis that require us to go to the side or even rotate for that matter. And so whenever you can add another dimension to your movement, you don't lose that option later on. So think about it. If you're 80 years old and you've never done this motion and you are put in a position where you have to step out to the side, you're not going to have the option, or the option is more limited because you haven't practiced this motion on a day-to-day basis. And if you think about fitness as a way to practice movement so you don't lose those options available, you don't lose movement efficiency later on, that's a good enough reason, I would say, to do things like lateral lunges, to do things like rotational movements so that you have those available to you even as you get older. Because if you don't use it, you will for sure lose it. That is for sure.
Yeah, I always think that the gym is the classroom for life. My practice, I'm about keeping you healthy and fit at this age until your golden years. And I think that's why Dr. Jerry and I get along so well, because we have the same values. And so I'm not the person that you would come to for bodybuilding. I'm gonna keep you healthy. And so that's why what I teach you in the gym, I would love for you to practice outside the gym. And we have so many opportunities to do that. It's not just about burning calories in this space.
Exactly.
But, no, that's fine.
And it's funny, talking about things like longevity, exercise is a big staple. And what we know from the research is that, especially with leg strength, and that's why we talked about the squat and lunge in particular, leg strength, when that goes, your balance goes, your independence goes, your mobility goes as a whole, and is one of the factors for all-cause mortality as you get older. So if you are, say, 40, 50, or even 60 watching this video, I do hope that you will change what you think about exercise as a way to add life. It actually adds a quality of life to the way you're living. And maybe you're at a point in your life where you've made the money that you wanted to make, and your kids are older and grown. My kids are going to be in college next year, so entering that phase of my life. But I want to make sure that the golden age is like now. It's not when you're like 70 or 80, it's now. So yeah, the earlier that you start, the better you're going to be later on, because you will have what you need to do to travel, and you'll have the stamina to do the things. You're not gonna have to worry about falling, or if you do fall, you'll be able to catch yourself because you practice different movements. Looking at exercise as a way to live a better quality life is what we wanna try to instill in you. Optimizing for these things now, today, maybe while you're watching this video, is the best time to get started.
That's what yes, absolutely. And my husband will agree with you as well.
Awesome. So let's move on to the next exercise, which would be the hinge.
Okay.
So with a hinge, what does that look like?
Going back to also life and having healthy habits, the squat and the hinge are probably going to be the most valuable in your day-to-day life of staying injury-free. So you squat to pick up a package. There's so many times, even I catch myself doing this, just picking up something off the floor with bad form. But if I can start to use a hinge instead to grab that, I'll save my back and continue to build leg strength.
And you actually use great muscles to be able to do that versus just relying your spine.
Yeah.
Not that we want to fearmonger you into saying, oh, you shouldn't bend forward, but when you have access to muscles and, again, movement options using the hinge, that's something you can just practice on a day-to-day basis. You're not going to lose that motion. And your glutes and your muscles in your legs are massive, right, compared to the rest of your body. So whenever you can access them as a way of practice in everyday life, the better they're going to be able to be utilized for what you need them to do as needed. Cool. So let's talk, what's your favorite cues for the hinge?
Oh, okay. So again, standing tall, start with your checklist. How's your kinetic chain lining up? So shoulders are back, rib cage over hips, feet are hip width apart. And so you don't want your knees locked, but they should be soft, and that's how they should stay. So I should be able to karate chop Jerry. And then imagine you also have a rod like running from the back of your head all the way down to your tailbone, and your spine then will move as one. So we want to keep that. I sometimes will even have them hold.
Yeah, that's a very, broomstick even, golf club, you can actually do that as well.
Anything. Yeah. Do you think it would help if they have hands behind their back if we don't have a stick?
It depends on the person, but that's not
okay, so maybe you could put lower at the top of your glute. So now from here, I want to think about pushing my hips into my hands as I start to lean forward. But the hips are going to lead the way as if you're backing into a parking spot. And when you'll feel your end point, you'll feel a nice lengthen through your glutes and your hamstrings. And at that point, then you can then push your hips forward and have a contraction at the top.
I love that. And I would probably use very similar cues. What I always say is I always use butt to the back wall. And the other visual analogy is imagine it's a cold morning and you're reaching for the cold toilet, leading your butt back there. Gets a laugh, but anyway, that being said, and the reason why we're going to do that is because it helps bias the muscles in the back, just like we did the hinge with the lunge. By using a hinge in these kinds of motions, we're also biasing the muscles in the back. Just like Darren mentioned, the glutes and the hamstrings, you're going to feel it quite a bit. One other thing I often say is shift your weight towards your heels. Yeah. So when you do that, you'll automatically have that access to the muscles back here and that movement pattern. So from here, I'll have somebody keep their hands on their thighs over here and let the hands slide down as they come back to position. Yeah, thank you. What you also notice here is that both Darren and I, we did not let our knees come all the way forward. That is a squat. So if you see someone telling you to do a hinge or a deadlift and they do this, that's a great squat. It is not a hinge. The hinge will come from the waist, as Darren mentioned, and it's almost like I'm giving a bow on the stage. So at that position, I'm going to feel that in the engagement of my hamstrings and my glutes in this position. I'll keep my hands along the thighs over here to make sure that people understand to slide up and down, which is an easier way to visualize.
Also, when you do add weight, you want that weight close to your body to protect your back. So.
Yeah, exactly. A lot of people run into trouble as they get into heavier weights. Number one, not to fearmonger, because if you can do that, great. But if you really want an efficient RDL or remaining deadlift or deadlift for that matter, keeping the weight close to your shins is going to allow for that to happen. You also get to access more of what the lats on the side of your muscles to increase stability. and increase tension so that when you do lift the heavier weight, you have more of your body involved in that movement than just you trying to hoist the weight up through your hands with a passive use of the muscles that can really help to get that movement even better.
So the way I practice the hinge on a day-to-day basis is as I'm brushing my teeth. So if I go to spit out the toothpaste, instead of rounding over the sink, I always try to push my hips out. And then that just keeps me in the mind frame of using my lower body.
Okay. Now, if you're really struggling with understanding how to get the hinge and, I don't understand what Darren or Dr. Jerry is saying about their knees, whatever, if you get a chair at home and get your calves to touch that entire time, and then go into the hinge position, you'll have this sort of feedback from the seat that you're not allowing your knees to come forward. So I keep pressing my calves against the bottom of the chair. I'm going to feel that tension into the hinge position on the right muscles over here, and then you'll be like, oh, that's what he means. So that's something else you can do at home that might be an easy sort of fix to why you're not getting the hinge or the deadlift later on.
I love that.
Do you love that?
Yes, I'm going to start utilizing this.
I just
learned something new.
I just figured this by accident. I was like, oh wait, this is an easy way
Yes, amazing.
Yeah, an easy way to understand how to hinge versus squat.
Let me get this. Yes, I did.
So easy, right?
It takes some concentration, but
yeah.
yes.
Yeah, so if you're pressing actively your calves against the bottom of the seat, you will get the hinge, trust me.
Love this.
Yeah.
Nice.
So that was a hinge, that's excellent. Let's go into some press movements. I know a lot of people try to do shoulder press, and there are ways that I like to coach that for people who have limitations. But Darren, why don't you talk about how you coach
okay.
a shoulder press?
Usually people come to me without limitations. If they do, I send them first to Dr. Jerry. All right, so grab a dumbbell. I usually like to start with one weight first. And okay, so we begin in rack position, and make sure, what I see a lot is that people's wrists are like this. And I know that's just from the world we live in of typing, but let's get that wrist neutral, almost turn those knuckles like towards your face. And you should be able to hold this weight for a good period of time because your arm is resting against your chest. Even though we're doing a press, we are still utilizing our entire body. So let's make sure that our feet are really pressing into the ground. Our core is engaged. Take a little inhale, exhale, bracing the core. Now from here, I'm going to punch straight up, and at the very top, I rotate, trying to get my bicep in line with my ear. And then I'm going to rotate again. Oop, it's hard to do this slow, and then bring the weight directly down. I don't want my elbow to flare to the side. Another thing that I try to cue is when we are in this overhead position to not allow your rib cage to open up, but we want to still keep that stacked down. Rotate, bring it down.
I'm so glad you mentioned the stack. Yeah. The stack we love to refer to as the rib cage sitting in line with the pelvis. And people have different patterns that they utilize as a compensation, but trying to keep that position for people who don't have issues right now would be a good position as well. Darren has amazing shoulder range, so I don't have that kind of range right now, to be honest. So what I like to do for myself and any patients who either have the sort of that little hump there and they don't have the range to do, if you start pressing against this or this, that's going to cause some problems in the shoulder over time, I can guarantee that. But easily what you can do is keep your shoulder or the palm facing one direction, which is over here. So think about the thumb going towards your face. And in this position, you can go up in that position here. And that is a little bit easier because the shoulder won't close up at the top over here. Again, if you've got the range of motion to do what Darren's doing, hey, go for it. I know for myself, I have to keep that open position of the shoulder in order to get the full range that I need to. So that being said, what I love that you mentioned, which I don't think it's cute enough, is when you are doing a motion where you are pressing a movement above or even forward in this position, anything where you are putting something away from your body, trying to ground yourself is so key. Because you want to make this a whole body experience. And if you are in that brace position, you have a lot more strength and foundation to draw from than if you're just haphazardly lifting the weight up and not only running the risk of problems happening, but also not getting the full benefit of the exercise and not making it a whole body kind of thing. Cool.
We use our entire body whenever we're doing something.
100%.
So it's hard to just isolate a muscle.
Yeah. As far as press movements goes, there's also the chest press or push-ups.
There's so much we could discuss.
Exactly.
But
one thing I would say that with the bench press, I'll just visually demonstrate it, is in standing, is a lot of people tend to have their elbows out too far to the side when they're pressing this way. One of the things I found to be more effective is actually bring your elbows down to where you're about 45 degrees. And as you press the movement up so in that position, you actually keep the shoulder in a better position for that press without compromising any kind of mechanics there. Again, this is just from my personal experience that this position seems to work better for the press as far as bench press goes than keeping the elbows at the side in a 90-degree position.
I thought the elbows were up higher, it's more shoulder focus versus if they're lower, then it's going to be chest. And so for women, I always say, try to get the weight in line, like with your bra line underneath.
I like that.
So.
Anything that we talked about, Darren, that you would change differently at this point for somebody who's maybe postpartum or menopausal, that is like your bread and butter? Love having patients go over there for that. But is there anything that you would tell them differently about even exercise in general?
They're two different. So postpartum, depending on how postpartum you are, to start off slow, to give yourself a good year to really, for your body to heal. You might feel fine, but you're still healing, like just your uterus and your hips and pelvis, it takes a good 10 months to go back to how it was. Yes. So do not rush, progress very slowly. And I advise seeing a pelvic floor therapist just to get looked at to make sure everything is okay. No, but we do have recommendations before you start working out. And then for menopause, I guess it's time to just stop the cardio and start lifting heavy, but again, start slow, and it's probably best to work with a professional so that you can learn proper technique and not injure yourself.
Yeah. Would you say that women who are, say, menopausal, I know their bodies might respond differently to exercise, but one of the things that I know about exercise, especially weight training and women who are menopause, is that it can help with managing hormones and stuff like that. True?
That is true. Yeah. It can also help with the menopause weight gain in the midsection. And cravings. It can help with sleep, hot flashes. Exercise is just amazing for everything.
Awesome. Great. And once again, if you are in the Raleigh area locally, Darren is your gal to go to. Let's go into a pull movement. So we talked about squats, lunges, part of the same sort of genre, hinges and press we did, and now we can talk about a row or pull.
Okay.
Yeah.
All right, so I always like to start with the single arm row. I keep going back to single arm or even single leg because, as Jerry mentioned, we have body imbalances. And so when I'm assessing someone, it's nice to see, or I like to assess what side of their body is stronger than the other. And I always try to start with the weaker side so that we can bring balance and equality to both sides. So that's why single unilateral exercises tend to be my go-to.
Great.
All right, so choose a weight. Always, you can go lighter and work your way up. I usually have some sort of support system. We're going to go into a split stance. I'm going to face this way. Thank you. And so you have your back leg. Now let's shift into those hips. So the weight is in our hips and not in our low back. And we have pressure into this hand. I like to allow the shoulder to fall forward in this position and then move my arm just slightly past my shoulder. This might not be for everyone, might not be for the very beginner person. Rest our hand here on the box, our right foot is back, weight is going to be in our hips, and we're looking for a nice flat back. My core is engaged. I'm gonna allow my shoulder to pull forward. You might even feel a nice little stretch there. And then for a new client, I will probably break my cues up. So if our shoulder is pulled down, I'm gonna have them first retract, and then from here lead with the elbow back towards the hip, and then slowly forward, and then again lower. So I would break the movement into two parts until we get comfortable with it, and then they could combine.
The one thing I would say is if you want to, the reason why we're doing any kind of pull, especially in a rowing position, is to work the side muscles over here and the lats. So one of the things I'll say is that I want you to crush a lemon between your armpit and your arm over here. So as you're coming, I want you to squeeze that together as you pull, and that'll help to engage that muscle a little bit more effectively.
That was a good one.
Yeah, like that. Good.
Also,
Someone else makes it.
and I just learned that the lats are shoulder muscle and not a back muscle.
That is actually true. They're going to work actually
work
like a lot of different, and they will definitely work the shoulders as well.
But
Attachment-wise, it's to the shoulder for sure, and to the bottom of your back, which is why it's a great muscle to work if you're looking for stability of the spine. But that's another video. The last motion we're going to go over today is the carry. So we have the squat, hinge, press, pull, and carry. So the big five. Great. So for the carry, one thing I would say is, and why do we do this? If you're looking to, I want to say the core carefully. Everything that we do right now is going to engage the core. But if you want to have a particular amount of bias there, what we don't want you to do is suck it in. And what Darren was saying before, just enough tension in the midsection, particularly in the sides over here where you're engaging, not to where you're flexing your hip, because that can lead to other problems later. But there are many variations of the carry. The reason why we incorporate it is because it is everyday life. Think about the grocery store, think about your purse, think about luggage, whatever it is that you do. It is a part of normal human movement. And this is something you don't want to be losing in your 50s and 60s or beyond. So practicing this now, increasing your weight progressively over time, is an easy way to start working on this particular movement. You can either hold a dumbbell or a kettlebell or grocery, whatever you want to do in your hand. There you go. Yeah, that gets really heavy. Water jugs. And easily, if you just kind of like, even just standing in place, if you're standing and keeping an upright position, keeping everything nice and engaged, again, as Darren said, I do also like to keep a little bit more in this core area here engaged. I'm going to actually just walk slowly in place. This is also going to challenge my balance a little bit too, as I'm going up and down. But if I go for distance, this can get pretty taxing over time, especially because if you're going for heavier weight and you're trying to keep yourself upright, your body being able to balance yourself out so you don't fall over to the one side is quite a bit of effort. And if you do this on a day-to-day basis, which you can, because these muscles are made for endurance type activities and to do things on a regular basis, daily basis, this is an easy one to do. Again, progressively increasing your weight will also help to work your grip, which is another thing another quality that's involved with longevity. Imagine, and you probably know this, like it might be hard for you to open up jars or open doors. That's something you don't want to lose. It's a skill, a movement pattern that you don't want to be, or with an option you don't want to be losing. Simply by holding heavier things in your hands is a great and easy way to do that, practically speaking.
I agree. Now, if you want to start off with weight in both hands, it's a little bit easier, at least until you find your balance and core.
Good point. Yeah.
Trust me, one weight, it's definitely challenging. So holding the weights, and then even if you find going into a single leg balance is difficult, just try going onto the ball of your foot.
I like that.
And then over time, you'll be able to lift it up higher. And I always like to imagine I have a book on my head and I'm trying to not let it slip
There you
off.
go. Eyes forward. That's a good point.
Yes.
Yeah. And the other part of this, if you want to progress from, say, a position where you're holding at the side, if you want to change the angle or the way that the load is presented to you, so in this case, having the dumbbell maybe out at a 90-degree angle, which works different muscles as well, this will also challenge you a little bit more, and then also holding the weight above your head, challenge your balance a little bit more and your stability too. So again, many different variations, whether you're holding at your side or through this range where you're holding it above your head, is going to be working the muscles that are necessary to keep you upright, which is always what you want to be doing until the day that you're called from this earth into the grave. Starting morbid there. That being said, anything else, is there something different you might do for either the press, the pull, or the carry for somebody with pelvic floor issues or with maybe postpartum kind of things?
No, I think the carry is one of my favorite exercises for postpartum. I mean, because the moms are doing a lot of carrying. You have car seats, and so that's one of the first exercises that we go over, especially how to pick up a car seat and use your core. So just training with one weight going, and even just standing there and trying to balance. It's a great way to start activating your deep core muscles.
Awesome, great. So today was just a basic intro to some of the common movement patterns that humans should be able to do. And we don't want you to lose this ability to do any of these motions or movement patterns that we talked about today, because again, if you are, as healthcare has improved overall over time, people are living longer, and you want to preserve that quality of life as you get older. So getting these movements down would be a great way to start, and progressively loading over time. Obviously, working with a qualified physical therapist or a qualified trainer like Darren over here is going to help to fast track your progress and to make sure that you're doing things correctly so that you don't get sidelined by things that were preventable because you did things wrong, because you watched the wrong video, maybe you watched your buddy in the gym who's also doing the exercises wrong, and so now you're both in trouble. Making sure that you work with a professional so that you can get the technique down is a great investment of your dollars and time, so you get everything done right. Darren, anything you want to share on that?
No, but just thank you for letting us be here today and share this information with you all.
Awesome. And if you have any friends out there, or if you yourself know somebody who could benefit from this, and for yourself, please and subscribe. We love to get more content. Please leave comments below to let us know if this is the kind of content you'd like to see. And we'd like to grow on this area as far as showing the things you can do to make your quality of life better as you get older in life.